In today's news for you, the prevalence of thyroid disease. Dr. Melanie Seybit is with Lexington ENT and Allergy, and she's going to be giving a free lecture next Monday at Lexington Medical Center. I'll give you all the information on that coming up here in just a moment. But first, doctor, let's talk about the fact that we're hearing about more numbers, more thyroid cancer, more thyroid issues. But is it necessarily there are actually more cases, or you're just finding it more easily now?
There are two schools of thought. You know, some people are under the school of thought that it's occurring more frequently, but most of us subscribe to the thought that we're actually finding more cases and we're finding them earlier. So methods of detection such as thyroid ultrasound or even CT scans are being done incredibly commonly for other problems even. And so I think we're finding more cases of thyroid cancer, thyroid disease in patients who otherwise may have gone unnoticed.
And I'm hearing that it seems to be more women that have it than men. Is that correct?
That is true. 1 in 3 women will have a thyroid nodule at some point in their life. 95% of those are non-cancerous. But because women have such a large portion of thyroid nodules, by default, more thyroid cancer cases are in women.
I was blessed to have a really good doctor because I could never feel the nodule in mine. So how does a woman know if she might have it? Because I had no symptoms whatsoever.
And that's most common. Most commonly, women have, or people have no symptoms of thyroid cancer. Obviously, if you feel a lump in your neck, you need to talk to your doctor and get a thyroid ultrasound. A thyroid ultrasound is the best way for us to image, to look closely at the thyroid gland. But it's very rare that thyroid cancer causes problems. Sometimes there will be trouble swallowing, sometimes there may be hoarseness, but most commonly women are like you and have had no symptoms.
I hear a lot of women say, I'm so tired, it must be that I have hypothyroidism. There could be truth to that, but there also could be untruths to that.
You're exactly right. It's so common, you know, women, people, we are all busy. You know, we're moms, we're working, we're doing all these things, we're not getting enough rest. So the thyroid definitely plays a role in metabolism. So there are times when, yes, your thyroid may be part of the reason that you're feeling tired and sluggish. The good thing is we can test that very simply. It's a simple blood test to tell us if the function of your thyroid is normal or not.
Excellent. You are going to be giving a free lecture on thyroid disease next Monday at 6 p.m. inside Lexington Medical Park 1 Auditorium on the hospital's campus. Call 936-8850 for more information, and I've put all the details and more on the big red tent on our website. And if you would like to ask Dr. Seybit any of your thyroid-related questions, go right now to Twitter. Whoops, I forgot to write that in there, my producer, I'm sorry. But if you send me a tweet, and my Twitter handle is Dawndy, W-I-S-T-V, Dawndy, W-I-S-T-V, and the doctor will answer your questions after the break. Thank you so much. Well, a little later in the show, actually. Thank you kindly.